South African blood donors, those who save lives. Iron is here thanks to iron tablets provided by the SANBS, trusted to restore the iron we lose from donating blood. And we're all here to iron things out about the SANBS issued iron tablets, how they work, and why it's important for you to use them as a blood donor. Hello to you and you and you and everybody sitting either in their homes waiting for the neighbor to leave so you can use their Wi-Fi or whatever it is that you're doing. This is the iron table. Made out of wood, yes, but we're here to iron things out because iron is here. I'm Dr. Musam Tomini, joined by a panel of experts, entertainers, of lovers and friends. We are here to have a frank discussion around blood donation. Let me introduce you to the panel today. We've got Larai. How are you, Larai?
I'm great. How are you doing?
Very well, thank you. Are you ready to give us very well-informed opinions about blood donation?
I'm actually ready to ask you all the questions.
Let's not do that. Let's not do that today. A man that you face, you definitely know. You see him all the time. He's normally, dealing with the voices, but today he's dealing with the blood. Proverb, how are you, sir?
Blessed, Dr. Musa, and yourself?
I know all is well.
Yes,
a lady
sir.
whose voice that you hear all the time, wondering, oh my gosh, do I really need to go in that direction? Or the news is so devastating nowadays. But someone whose face you might not have seen, but if you haven't, there she is. Mel, how are you?
Hey, what's up, Doc? I'm great. How are you?
Good. Oh my, did you just what's up, doc?
I did.
Cartoons, people of the 90s. And of course, the last of the panelists today is someone that you know from social media, spending a lot of time entertaining us with all sorts of funny skits. Randy, how are you today?
I'm good. How's it, Doc?
Good, good. You've got a formal thing going on there today.
I can go there with you.
Oh, you want to go there?
Yeah.
I want to go there with you too. So we're having a discussion around blood donations, the first of the series, and we're covering a number of things. The mission of the SANBS is basically to save lives. That's the cornerstone of what they do. You understand that they deal with blood and blood products, and the main aim of what they do is to make sure that if you get into a car accident, if you are someone that's got anemia or something along those lines, get into a scenario where you're going to need blood, they are there to provide it for you because blood is life. And that's why we're here. So let's talk about the importance of blood donation. Pro, why do you think it's important to donate blood?
I think, like you said, my good friend, it's one of those commodities that you can't replicate artificially. You can't plant it and grow it somewhere, not yet at least, as far as we know. So, because we have a lot of compatibilities, if there are injuries, accidents, and I always think we need to flip the table around. Because should you ever be somebody who needs blood, you will certainly hope it is there in good supply. So now that we have an opportunity to donate, I think we should for others as well.
Do you know someone that donates blood, Randy?
I myself, I do.
Oh, nice.
donate.
So tell us about your blood journey. How did you get into donating blood?
I started donating when I was 18. I once experienced this in my family. One of my family members actually needed blood to survive whatever that was happening. So I actually got to appreciate donating blood. That's how I got into donating.
Have you had a donation experience?
I found out that I was anemic, iron deficiency. So I haven't had the opportunity to donate yet, but I'm so glad that now SANBS is offering iron tablets because, now I can at least get into it as well.
So glad you're here because we're ironing things out with you. You're the prime example case study. And we're going to use you to make sure that everyone that has an iron deficiency anemia, everyone that is sitting thinking, but if I donate blood, what's going to happen? That you get the right information, know that you can take iron supplementation provided to you by the SANBS or your doctor. You say, I pop this pill twice a day or once a day and I can actually get back to normal levels. That's great. And that's why we're here today. So let's talk about the eligibility criteria that you need to fill. Bro, what do you think you need to have in order to be able to donate blood?
Doc, I know I definitely have the one, which is I am the right weight. In fact,
Thank you.
I'm well above it. And that's the one I'm sure of. I also know high blood pressure is the other. And perhaps, Doc, you can maybe speak on it a little bit because I've been turned down once before because my blood pressure was too high.
Yeah.
So maybe just break it down for me a little bit. Why is that?
If you're sitting and you've got a high blood pressure or a low blood pressure, we don't want to take blood from you because there's clearly something in the background going on. And we don't want to take blood from you when there is something going on. So there are other things as well, like an age one, which is important, which is 16 to 75. The weight one has been mentioned, where you have to be over 50 kilograms. I'm going to go to Mel now and ask her if you've donated blood before.
I have not.
Okay.
And I think it speaks very much to the culture. I think if you grow up with it, if it's something, I see now they do it obviously in high schools, to kind of encourage high school children to donate or the kind of awareness drives and things like that. But when I was, young, there wasn't that stuff. It wasn't something we did. I didn't know anyone who did it. No one in my family did it, so it's just not something I grew up with. And it is something, like I say, when I see the post saying we need, then I'll think, oh, I should, but I actually haven't.
The important things when you're donating blood is that you've got plasma, you've got red blood cells, and you've got platelets, right?
Okay.
So red blood cells are the Musa
get my
was
notepad. Wait.
riding his bicycle, fell, and now he's bleeding profusely on the side of the road. They take me to hospital, they check my HP, and they say you got low blood, sir. So they have to give me blood. So they'll give me red blood cells. And that tops me up, and I feel great, and I say, let me go home. Then you get instances where some people have got clotting disorder, so they actually can't clot. So the platelets in their system are either too low or whatever it might be. So if they get into an accident or something like that and they start bleeding, they can't stop bleeding because they can't clot. And that obviously brings about an issue where if Musa donated his whole blood, they've split it now, and they can take the platelets and give it to now the new guy that needs the platelets, and he gets that sorted out. And there are patients that need plasma for an array of conditions as well. So that's why when you're donating blood, you're not just donating red blood out of your body. They can actually split it and save 3 lives. That's why it's so important to have these, continual blood donations that you do. And you've got about 56 days in between donations, giving your body enough time to make what you've just taken out. So when you're donating blood, red blood cells come out. And inside, red blood cells and the blood that you've taken out, iron goes with it. And iron is very, very important. So what iron does is that it's responsible for, all the nice things that we like, skin, hair, and all of that. But it's very important in the making of red blood cells. You need red blood cells to make your hemoglobin and, all those sort of things that exist. And once you've got all of that, then that's obviously high. So if you're low, and the reason why we wait 56 days is that you give your body time to replenish those stocks so you can go donate again.
So where does the iron come in now? Because I think that's something that I didn't know was an issue or, could be an issue until it actually affected me. So where do the iron tablets come into this whole process?
So there are different nutrients and supplements and things like that that people will take. An important thing about iron is that we normally take it in the food level, right? So red meat, some fish, beans, and green leafy vegetable, all the run-of-the-mill when you go to Goko's house type things that will be on your plate, That's where you normally get your iron. But some people have got malabsorption syndrome, so they actually can't absorb. They just don't eat the right food. I mean, we don't live in a very rich country where people can afford to have meat every day or eat green leafy vegetables. So you have a deficiency of iron. When you have a deficiency, you'll find that some people then find themselves then being anemic and having sort of those deficiencies that exist. And when you've got those deficiencies, then you can't supplement normal processes that happen in your body. And that's what then leads up to people having maybe terrible skin from, if you've got an iron element that's low, or you having anemia and things such as that. So that's why it's important to take in the normal food. And that's why we'll always advocate for people to go out, eat a healthy diet. But for those that don't know, because not all of us have got access to blood testing where we can check and say, oh, you've got low iron. If the diet isn't enough and you don't know your medical history enough to say that, oh, I know for sure I don't have deficiencies in A, B, C, D, we can supplement you if you're donating blood to say that just in case we know what's going on here, let's sort out this issue by giving you these tablets. But look, very insightful conversation. I'm very happy with all the questions that you asked. Next time, I'm asking you questions because your homework for next week is, and so on and so forth. Thank you so much for joining us. Remember, iron things out. Go speak to your healthcare providers. But if you are someone that donates blood between the ages of 16 and 45, you make sure that you go out and get your supplementation of iron provided by the SANBS so that you can get healthier and healthier and keep donating blood to help all those that you can. Because the cornerstone of health is brought to you by SANBS to provide blood and blood products to people that need it the most. From us, the panel, including Musa Wilson, this Bri here, of course, Lerai, Proverb, Mel, as well as Randy. We'll see you again soon. We hope we've answered your questions about blood donation. Otherwise, ask away in the comments section. Till next time, donate to save lives and iron things out with our iron tablets to restore the iron lost from donating blood. For more information, visit www.sanbs.org.za.